Hi and welcome to State of Mind with me, Dr. Shyam Bhat. I'm a psychiatrist and physician, and this is the podcast about everything to do with the mind. To all my regular listeners, I want to apologize sincerely to you. I'm sorry that I haven't had an episode out in the last couple of months. I figured out the recording situation now. It's not hard to figure out, I know, but it's taken me a while. So this is being recorded from my house in Bangalore, and so you're going to hear some passing traffic, maybe some vegetable vendors, some construction, but hopefully also the sounds of nature, birds chirping and so on, because thankfully that is still going on all around us. Anyway, thanks for joining me on this episode, and today I'd like to discuss the role of the body in emotional health. We're going to talk about the mind-body connection, how the body influences the mind influences the body. And in fact, we're going to, I think, understand that even that phrase, the body influencing the mind or the mind influencing the body, is incorrect, since they are actually one. Now, you know that your body is always involved in the experience of any emotion. We all know that. What is anger without your heart racing or your fists getting clenched or your brows getting furrowed? What is sadness without a visceral experience in your heart? What is joy without some sense of exhilaration in your body? Unlike thoughts, emotions don't exist only in the head. Emotions are not just a neurological brain experience. Emotions, by their very nature, by their very definition, is something that happens to our entire being. Without the involvement of physiology, there can be no feeling. So hypothetically, if I were to remove your brain out of the body and keep it in a tank of nutrients so that it is alive, and you generate the neural impulses for joy or anger or sadness, for any emotion, there will be no feeling. It will just be neural impulses. That's it, just electrical energy. Without that electrical energy also doing something with the gut and the bloodstream and the blood pressure and the heart rate and the hormones and the muscle tensions and all of that, there is no feeling. Now, you might think I'm belaboring an obvious point, but the reason I'm going on about this is because it struck me many years ago when I was entering the field of psychiatry that the body is really being ignored in psychiatry. The body is being ignored in psychiatry much as the mind is being ignored in physical medicine. So much of physical medicine acts as if the mind is something else that may affect the body, but is really not central to the quote-unquote physical issue, in that you look at diabetes and you say, hey, that's a physical illness. And then you look at depression and you say that's a mental illness. And yet, if you look at diabetes, you'll realize that in terms of causation, in terms of treatment, in terms of outcomes, so-called mental aspects are as important, if not more important, than the so-called physical aspects. So in diabetes, for example, stress increases blood sugar by increasing insulin resistance. Stress causes inflammation, and inflammation affects every organ, including the pancreas. Stress causes behavioral changes that result in food choices and dietary and exercise and lifestyle choices that worsen blood sugar and glycemic control, from maybe choosing to smoke to alleviate tension, to not sleeping well because of stress. Both of these behaviors radically alter the insulin system and do increase the risk of diabetes. And then the diabetes itself will cause changes in the person's mental state. We know that it increases the risk for depression. And we know that if a person has depression and anxiety and diabetes, treating the depression or the anxiety greatly improves blood sugars in the person with diabetes, the so-called physical illness, which in fact is a mind-body illness. But you cross over to psychiatry and you see the same tragedy being enacted with our understanding, which is, if you look at depression, people think it's a mental illness, or at best a condition of the brain. So with depression, if you look at the diagnostic criteria, there are many cardinal symptoms of depression that are physical, like sleep, appetite, and energy. But there are a great many symptoms that people suffer from when they have depression that do not make it to the list of diagnostic criteria, because this list of diagnostic criteria was determined by Westerners, primarily by Western theorists, and they look at this from a very Western-centric perspective. So, data says that people in the West do not experience as much bodily symptoms, physical symptoms of depression as people in the East. And when I say physical symptoms, I mean that you could be suffering from in addition to the symptoms I just listed out, like energy and appetite and sleep. Some of the common physical symptoms are aches and pains all over the body: headache, neck ache, abdominal pain, back pain, strange unexplained symptoms like numbness and tingling. They can have digestive issues, a sense of weakness, a sense of physical weakness, and so on. Now, according to Western theory, this is occurring because people are not able to communicate and understand their feelings, their emotions, in a psychological way, and because of that, it is converted into physical symptoms. The presupposition from the West is that it is less sophisticated to feel physical symptoms, and that if you don't feel mental symptoms, then the whole role of therapy is to help a person talk about his feelings or her feelings and get it out of the system by conversation, so that these symptoms don't continue to affect them in their body. Now, this makes complete sense if you're raised in a very Western theoretical model, because you see the body as being not the more honest kind of representation of feelings, it's really the mind. So if you're feeling angry and your whole body is tight but you can't talk about it, that means you haven't really gotten in touch with your anger. And then the role of the therapist becomes trying to help the client get in touch with their anger by talking about it. Now, of course, this is a very useful and important strategy, but I want to highlight the fact that there is no inherent superiority of one symptom over the other. It's not as if a person has to be coached into talking about their feelings if all they feel is symptoms at the level of their body. In fact, the problem is that we have to evolve certain systems and certain therapeutic techniques that will help address the symptoms at the level of the body itself. Now, let's first ask ourselves, why is there any physical symptom at all? What is going on in depression or anxiety that is causing a person to have symptoms in the body? So let's say a person is suffering from severe back pain and they go to their doctor, to their orthopedic surgeon or to a physician, and the doctor examines them and finds that this looks like lumbar disc prolapse, and maybe even gets an MRI scan done, and you find that yes, there is a disc prolapse. There might be a tendency to now say that, look, this is a physical problem. This problem has happened because of the disc prolapse, and the disc prolapse has happened because of some physical weakness. But like the physician John Sarno, by the way, he's written a couple of great books on the psychosomatic nature of back pain. As he and countless other people have observed, back pain, like many other pain, physical pain, has powerful emotional reasons. Now, you might wonder, how can emotions cause pain, and aren't we seeing disc prolapse? Clearly, it's a physical condition. Well, firstly, let me just say that studies have shown that you can randomly do MRIs on people in the general population, and you'll find that about 20% of them have disc prolapse, but no symptoms of pain. Having disc prolapse does not mean that you're going to have nerve root compression and pain. It's often an incidental, inconsequential finding. Having said that, when people have emotions, for example, with back pain, it's typically either grief, loss, or anger. It alters the way a person sits, stands, breathes. It changes the autonomic nervous system, and therefore alters the entire tension, musculoskeletal tension and tension in connective tissue throughout the body. So there's actually an increase in tension within the abdomen and pelvis. The person doesn't know it. They're sort of more rigid. They're holding their breath. And this is the way the body is responding to the emotions that they're feeling, that they're going through. In fact, the body is trying to process this feeling and trying to deal with this feeling. Remember, the feeling is both a mind and body experience. And so the body is holding tight. The anger is locked in or the hurt is locked in. Increases intra-abdominal, intra-pelvic tension, causing more intravertebral pressure, which then pushes this stuff called the nucleus pulposus out, causing a worsening of the disc prolapse, and then impingement or pressure on nerve roots, causing pain. So the pain is real, but emotions, because emotions are a physical experience, obviously affect the body. Now, this is just one example. Time and again, we see that what are called physical illnesses are being affected by the mind, and what are called mental illnesses have essentially physical manifestations. This, by the way, is one of the reasons that back when I initially started post-graduation in psychiatry and realized soon enough that, this is an artificial distinction, which is why I ended up training in both internal medicine and psychiatry. But the interesting thing is that, even in the West, even if you end up doing both medicine, internal medicine and psychiatry, the way that the vocabulary and the science has developed, it does not allow for a synthesis between these two fields. There's no vocabulary to even describe the mind-body experiences. But anyway, coming back, I'm digressing a bit, but coming back to what we're talking about, just as internal medicine, the field of physical medicine has almost denied or reduced the importance of so-called mental factors in physical conditions, psychiatry, I think, has done far worse in that it has denied the body when it is obvious to everybody, including everybody who is not a mental health professional, that the body is a part of our emotional lives. And yet, when we talk about psychotherapy, we almost think that it is synonymous with talk therapy, because it is synonymous with talk therapy now. But in fact, talk therapy means that you're talking about a problem, and by talking about the problem, we have to understand that we're using something called the prefrontal cortex. From a brain perspective, emotions are occurring primarily in what we call subcortical structures, the limbic system, and essentially parts of the brain that do not give rise to words. They are not engineered to talk. They're not engineered to think. They're not engineered to think about the world in terms of imagery. They're engineered in a different way. Feeling is a very primal, as we've talked about, a primal visceral sense. But when you talk about something, you're talking from it's actually not you talking, it's your prefrontal cortex talking. Describing emotions with words is the task of poets and novelists, right? Ultimately, that's what a poet is trying to do. That's what a writer is trying to do, which is to describe the rich sensations of emotional life using words. And that's always a difficult thing to do. The other thing to understand about emotions is that they are what we call a qualia, an irreducible experience. Unless you've experienced a feeling, no words can describe the feeling. If you haven't tasted something sweet, no amount of words will describe the taste of sugar. You have to taste it to understand what that taste actually feels like. That's the same thing about emotions. You can talk about it ad nauseum, but there will always be a gap between the words and the feelings. And Western psychotherapy has almost denied this. And of course, we have to blame Sigmund Freud, because he, of course, is in that sense the grandfather of Western therapy. But even Sigmund Freud, who talked a lot about, the mind and so on, the subconscious and so on, he used to use massage, physical massage for his patients. But of course, that had a lot of unpleasant and difficult issues, including boundary issues. And thankfully, that was stopped. But not so thankfully, the body was then totally thrown out of psychotherapy. And so, for decades after that, we in this field have acted as if the person, the client, the patient is a talking head or just words. I should say historically, though, although Sigmund Freud rejected the notion of the body, one of his early disciples, Wilhelm Reich, R-E-I-C-H, who was Austrian, and then was expelled from Freud's inner circle for not agreeing with Freud. Freud famously, by the way, was quite a narcissist, hated anyone who didn't agree with him. And if you didn't agree with him, you were banished. It was a huge issue, It meant the death of your career back then. But Wilhelm Reich was banished for his belief that the body was an essential part of the mind, and he actually went on to describe something he called character armor. Character armor, he said, is when you look at a person and you look at the way they stand and the way their face and their posture is, you will notice that all of their emotions, their feelings, and the way that they defended against this feeling of insecurity and fear in this world as children, that has become like an armor. The psychiatrists might know this. In some textbooks, they talk about something called the Varagats Fold, Veraguth. Varagath was a Swiss neurologist, and he published a paper where he described a fold of skin on the upper eyelid that he said was seen more commonly in people suffering from depression. Now, there have been some studies looking at this, and we don't think this is a consistent enough finding to be diagnostic, but nevertheless, the idea that there are physical changes in the body that occur with prolonged emotion is something that people have observed for centuries. But somewhere along the way, like I said, it just went out of psychiatry, out of psychotherapy. Fortunately, now in the last few years, there's been a resurgence of what we call somatic psychotherapy or body psychotherapy. Now, some years ago, when I was treating people for depression and anxiety with an approach that involved sometimes medicines, always psychotherapy, talk therapy, and obviously I was integrating a lot of meditation. And by then I was also using a lot of yoga in my practice, because yoga is essentially a mind-body practice. And if you read yogic literature, you know that yoga is not about physical exercise or physical health, that the ultimate goal of yoga is to attain moksha. And moksha means a state of bliss, a state of connection or merger with the universe. For self-realization, for ultimately your psychological journey, you need to involve the body. And it is a fact, every yoga teacher will tell you, every yoga practitioner will tell you that when they do yoga, certain emotions come up unexpectedly. A person is doing a chakrasana and suddenly there's feelings of maybe some sadness from the past, some trauma from the past. A person just breathes. And I see this so commonly with people who are holding back feelings. If you just take a deep breath in and breathe out through your mouth, if you're holding feelings, you'll notice that your body is holding on to the breath. It's not even allowing itself to breathe out because of some chronic anxiety or fears or tension within the body, within the mind, which is the same thing. And so it became clear that when you bring together talk therapy, which addresses feelings at a cognitive and a prefrontal cortex level, and also physical therapy through yoga and breath work, people were getting unbelievable results. They were getting insights that conventional therapies, which did not use yoga or bodily techniques, were not getting. But I also saw that for many people, this was not sufficient. I saw that what Wilhelm Reich had observed in the 1930s was absolutely true. You can see this for yourself. Look at your posture or postures of people around you, the way they stand, and ask yourself, what does that tell you about how they see themselves within this world? Is their chin jutting out as if they have to fight with the world? Is their tail tucked in out of fear? Is there tightening in the chest and abdomen as if to protect themselves from invisible or impending blows? What is going on in the body will tell you a lot about how that person implicitly sees themselves in this world. And when you adopt a certain posture and you hold yourself like that to deal with feelings, it starts early in life, and you continue to hold your body like this without being aware of it. And although the body is in pain, you don't even feel it, because what happens then is the body becomes numb. And so what I would see is when people would get treated, they would say that I'm feeling better, but somehow I'm not all there. I still don't feel completely okay. For example, a person does cognitive therapy and they know that they have to think positively or a more balanced way, and they have a more balanced thought. They've changed their beliefs in that sense, but something feels wrong. They don't still feel completely confident or completely relaxed or completely happy. And that's when I realized that there is an organ in the body that is not being addressed, and that organ of the body, if you like, is the fascial system. Now, the fascia is connective tissue. It's not one organ, and it's like the skin, except it's underneath the skin, and it envelopes every part of the body. That's fascia. Fascia. Now, fascia interestingly, is something that, as every doctor is very familiar with, right from our days in anatomy when we are dissecting bodies. But interestingly, this is how every school of learning, whatever school you're exposed to, will train you to see certain things and ignore certain things. And so, interestingly, when we are dissecting the body, the manual of dissection, famously the Cunningham manual, will tell you cut through the skin and then cut through the superficial fascia and the deep fascia, and then just expose the muscle. So it's not asking you to look at the fascia and wonder what it's about. It's saying that it's getting in the way of the actual organ that you want to see, which is the underlying muscle or the underlying nerve or artery or whatever. But think back, if you're a doctor, think back to all of your dissection, and you will realize that what the books tell you is just so fascinating and true, that every organ in the body is sheathed by fascia. It's not just the muscles. Every nerve, every artery, every vein, everything is wrapped around. Think of a cling film that is wrapping everything, and not just outside, underneath the skin, but also deep in your organs. So there's what we call visceral fascia, which is enveloping your intestines, your stomach, your pancreas, your liver, everything. Now, by this time, what I had observed in yoga in people who were sort of had emotions that were being held for a long time, you could see how the asanas were bringing out the emotion. But clearly, there were many people who had held on to emotions for years and years, and yoga was not enough. I needed to find a more direct way to address the emotions that were being held in the tissues. And that's when I delved into what is called myofascial therapy, which is essentially a technique used by trained physiotherapists. Now, what a skilled physiotherapist in myofascial therapy and trigger point therapy, what they do is use the knowledge of anatomy and the right feel for the tissue to start manipulating chronically tense tissue. When the person is experiencing this movement of tissue, there's actually a lot of movement of emotion. Now, this is one important technique in terms of releasing chronic feelings that cannot be processed by the prefrontal cortex. And of course, remember that a lot of feelings cannot be processed because they're so deep and they are primarily physical sensations. So in this, in myofascial technique, as the therapist releases tensions and chronic knots, and I know some of my physician friends are hearing this and thinking this doesn't make sense. I'm going to address this a little more. But I'll first tell you anecdotally and empirically what happens is that people start getting in touch with feelings, thoughts, and memories that they did not even know they had. It just comes up spontaneously. And then when you combine that with therapy, so they have a session of physical therapy, of myofascial release, thoughts and feelings come up, and then that can be talked about and understood in light of where they are now, processing past trauma, bringing it up to the conscious present and letting it go. This can be done so much easier if we talk to the body directly using physical therapy and various direct techniques rather than just waiting for the person to break through defenses emotionally, which is what a lot of therapists do. So this is quite profound. And there are many other techniques, by the way. Myofascial release is one somatic technique. There are lots of other somatic exercises which involve breath and various postures, and including using yoga in a very precise way to get in touch with feelings that are being felt in the most honest way possible at the level of the body. Of course, they were held in the body because they were not processed. But it doesn't mean they have to be processed only through conversation. It has to be done by addressing at the level of the body and breath, and then along with conversation. So what does this all mean for you? Well, here are some of the key insights that I think can help all of us have better emotional health. The first thing is to understand that the body is honest. The body is speaking to us, and the body is telling us something, and the body has infinite wisdom. And therefore, we must learn to pay attention to and listen to our body. And how do we listen to our body? It's by tuning in to the non-verbal signals of what's happening in our body. Our entire world today is focused mainly on ideas, thoughts, and very tangible things. And to that end, emotions have been crowded out of this sort of globalized capitalistic world. And yet, it is feelings that are at the heart of your decision making, at the heart of your quality of your life, at the heart of almost everything that is happening. There's the background of your emotional tonality. And so, yes, we live in a world where increasingly feelings are seen as inconsequential, but because our hardware has remained unchanged and will remain unchanged, despite changes in our environment, we have to understand that feelings are very consequential and we have to learn how to process it. And so tuning into the body means tuning into your feelings, and tuning into your feelings means to tune into your body. And how do you tune into your body? Well, the best way is to tune into sensations in the body, to notice what is happening just in terms of what the body feels like. Interestingly, in Sanskrit, the word for health is swasthya. And swa means self and sthya means place or home. And the implication is that when you come home to yourself, mind and body, you are healthy. So as our mind gets involved with projects and goals and ideas and thoughts and desires, it moves away from the center of our being, from just the non-verbal, continual experience, the flow of your sensations, the sense of who you are moment to moment. So bringing your attention to that is deeply healing. And just that, just non-judgmentally experiencing your body will start releasing these feelings. So I'd like you to try that. And the way you can do that is to do yoga nidra or body scan. And there are lots of sessions out there. In fact, I'm going to put a lot more meditation sessions on this channel. So please try that. The second thing is, whenever you feel some pain, whether it's in your back, of course, by the way, this podcast and none of my podcasts and no podcast actually replaces the need for a medical evaluation. So first, always get a medical evaluation. But, if it is a pain that is not, doesn't have a serious medical cause that needs any other intervention, just notice it. Experience it. Don't block it. Breathe through it. And almost ask yourself, what is this pain saying? So, for example, if you have neck pain or back pain or headaches, these usually have strong emotional components to it. Breathe, notice, experience, don't resist, and just allow thoughts and feelings to come without blocking them and write them down. You'll notice that non-resistance and allowing it to express itself will reduce the pain significantly. And by the way, in your comments, please do tell me how and if any of these work for you and what your experience is. Yoga, meditation and pranayama are always amazing mind-body techniques that will help you not just with your physical health, but also with understanding what's happening emotionally. It will help you let go of feelings that are blocked. And one of the key things about feelings is for us to experience them without blocking them or holding on to them. Well, I see I've kind of exceeded my own appointed time for this podcast. I wanted to keep it short, but there were so many things to talk about, and I'm going to take a more freewheeling approach to this podcast, not really try hard to fit it in 15 or 20 minutes. Depends on the topic and depends on the day. Obviously, the production qualities are not going to be as great because it's not being recorded in the studio. I'm sure you can hear a lot of ambient sounds. But I hope you enjoyed this episode, and I want to thank you for joining me on this episode of State of Mind. So thanks for joining me, Dr. Shyam, on this episode of State of Mind.